Does brain cancer cause hearing loss in patients? Let's dive into the intriguing question of whether brain cancer can lead to hearing loss in patients. Brain cancer is characterized by the growth of abnormal cells in the brain or central nervous system. These tumors can be primary, meaning they originate in the brain, or metastatic, meaning they spread from cancer elsewhere in the body. The symptoms of brain cancer can vary widely based on the tumor's location, size, and growth rate. Hearing loss is defined as a reduced ability to perceive sound. This condition can arise from various factors, including damage to the structures of the ear, the auditory nerve, or the brain areas that process sound. Common causes of hearing loss include aging, exposure to loud noises, and genetic predispositions. Now, how does brain cancer relate to hearing loss? Brain cancer can potentially cause hearing loss if the tumor grows in or near regions of the brain that are responsible for processing sound. If the tumor compresses or damages the auditory nerve or related structures, hearing loss may occur. For instance, tumors located near the brainstem or temporal lobe can disrupt the pathways that carry sound signals from the ear to the brain. However, it is crucial to note that hearing loss is not a common symptom of brain cancer. Most brain tumors do not directly impact hearing unless they specifically involve the auditory pathways or cranial nerves associated with hearing. When hearing loss does occur in brain cancer patients, it is often due to the tumor's location and its effect on surrounding structures. It is also important to differentiate hearing loss caused by brain cancer from other causes. For example, sensory neural hearing loss typically arises from issues in the inner ear or auditory nerve, rather than the brain itself. Brain cancer is a rare cause of hearing loss when compared to more prevalent factors such as aging or noise exposure. For patients with brain cancer who experience hearing loss, it is vital for healthcare providers to identify the cause. This process may include imaging studies, hearing tests, and neurological evaluations. Treatment options for hearing loss in brain cancer patients depend on the underlying cause. If the tumor is pressing on critical structures, treatment may involve reducing the tumor size through surgery, radiation, or chemotherapy. Emerging research continues to explore the complex relationship between brain health and hearing. Some studies suggest that hearing loss may accelerate certain aspects of brain aging or affect cerebral metabolism. However, this is distinct from the direct effects of brain cancer on hearing. There is no established scientific consensus that brain cancer routinely causes hearing loss, but it can happen in specific cases depending on the tumor's location and growth. In summary, brain cancer does not typically lead to hearing loss. While hearing loss can occur if a tumor affects auditory pathways or cranial nerves, this is not common. Most hearing loss in the general population is attributed to other factors. If a brain cancer patient experiences hearing loss, it is essential to seek a thorough medical evaluation to determine the cause and appropriate treatment. Always consult healthcare professionals for personalized medical advice.